We're going to turn now to the story of Britiney Maynard. Just 1 week from today, if all goes according to her plan, 29-year-old Britiney Maynard will drink a glass of water filled with a lethal dose of crushed, doctor-prescribed pills and drift off into a sleep from which she will never wake. Britiney's profoundly personal and private decision to end her own life after being diagnosed with a terminal, quickly advancing illness made the cover of this week's People magazine, and it has become the subject of international interest and discussion after she shared her story in this video posted online 2 weeks ago.
70 days post-op, I went in for another MRI and was told I had had a grade change. They were looking and saying it looks like grade 4, which is the worst and most aggressive form of brain cancer. It's called a glioblastoma. So that was a major shock to my system and the system of my family, because it went from having potentially years of time to being told I had like 6 months.
Doctors have told Britiney that if the cancer is allowed to run its course, the decline before her death will include a series of unrelenting seizures, headaches, nausea, vomiting, pressure in her brain, and the loss of all of her bodily functions, including moving, even thinking. Instead, on November 1st, the day Britiney has decided to die, she's planning for the end of her life to come on the terms that she has chosen for herself.
I plan to be surrounded by my immediate family, which is my husband and my mother and my stepfather and my best friend, who's also a physician, and probably not much more people. And I will die upstairs in my bedroom that I share with my husband, with my mother and my husband by my side, and pass peacefully with some music that I like in the background.
Britiney has said that in addition to a peaceful death, having access to the lethal prescription has also given her peace in her final days of life.
I can't even tell you the amount of relief that it provides me to know that I don't have to die the way that it's been described to me that my brain tumor would take me on its own.
Although she describes this as a private decision, following her diagnosis, Britiney has devoted much of this year to advocating publicly for others in her situation to have legal access to the same relief. She qualified for physician-assisted suicide after relocating to Oregon, where the practice is permitted under the state's Death with Dignity Act. Now, Oregon is one of 5 states, including Montana, New Mexico, Vermont, and Washington, that have legalized the option to end one's own life with the help of a doctor. 7 other states have introduced similar legislation, and Britiney has teamed with advocacy organization Compassion and Choices and launched the Britiney Maynard Fund to push for those bills to be enacted into law. Now, the particular circumstances of Britiney's story, a vibrant young woman, a newlywed, whose life feels like it's just beginning, compelled by illness to make a decision about how it will end, has drawn renewed attention and brought a new audience to an old and ongoing debate. As bioethicist Arthur Kaplan wrote for NBC News earlier this month, how we die has been an issue mainly fought out by the elderly. Some patient advocacy groups for the severely ill, disability organizations, pro-life groups, religious organizations, and healthcare providers. Most of the combatants are middle-aged or older. A whole new generation is now looking at Britiney and wondering why their state does not permit physicians to prescribe lethal doses of drugs to the dying. For more than 20 years, a majority of Americans have not only wondered but agreed that a physician should be allowed to legally and painlessly end the life of a patient with an incurable fatal disease. And that consensus has been tested periodically by events that have forced us all to consider the broader political implications of personal end-of-life questions. In 2009, Sarah Palin attacked Obamacare and stoked fears of government overreach into end-of-life decisions by invoking the mythical death panel claim. In January, a dispute in Texas over whether to keep a pregnant but brain-dead woman alive on life support was ended when a judge ordered a hospital to comply with her family's wishes to have her removed from the machines that were keeping her alive. And recently, right here on this program, Dr. Ezekiel Emanuel talked about his desire to avoid the onset of physical and mental disability that can accompany old age by dying at age 75. But that fundamental question, under what circumstances should a person be empowered to make the decision to die, also raises very different concerns about bodily autonomy than those we've become accustomed to considering in our public and political consciousness. We have been far more comfortable grappling, for instance, with the reproductive rights debate and fraught personal and policy questions that it raises about the beginning of life. But now, Britiney Maynard has compelled us once again to collectively consider where we stand when a decision needs to be made about the end of a life.